Hello and welcome to Sybil Wilkes Live. Yossi Media is proud to present Check In and Check Up on Your Health, a discussion on the importance of Black maternal health in partnership with the American Heart Association. Before the pandemic, Black women were 2.5 times more likely than white women to die from causes linked to pregnancy, according to the latest Centers for Disease Control and Prevention data from 2018. Although data regarding the pandemic's impact on maternal mortality won't be available for some time, medical experts and health advocates believe this crisis is intensifying among Black women. In tonight's Check-In and Check-Up show, we'll discuss the connection between Black maternal health and its effect on African American women, their families, and communities. Tonight's panel includes cardiologist Dr. Rachel Bond, actress, mother, and comedian Kym Whitley, and 2022 real woman Kisha Stewart, who will share her amazing story of heart disease and childbirth. And now, here's Sybil.
Hi, everybody. That was a rather abrupt ending, wasn't it? Hello, everyone, and welcome. I'm Sybil Wilkes, and today we continue our effort to check in and check up for your health, for our health, in partnership with our great friends at the American Heart Association. And yes, we're all wearing red, Arica, so we are right there in with you. And we're also looking at the importance of maternal health, specifically Black maternal health. My co host today, I'm so excited that she could join us, and I really appreciate her doing this from Cleveland, is my friend, comedian, actress, producer, my radio sister, and Joshua's mom, Kym Whitley. Hey, Kym.
Hey, Sybil, how you doing?
I'm
And my
good. How
brother
are you,
Scott
Cindy?
just ran out of here. Scott was like, "Is it on yet? Are we live?" Yes, the whole family. I'm in Cleveland, of course.
Well, I'm glad that you're home with your family, and I know that your dad is watching.
Yeah,
And my regards to the great Mr. Whitley of Whitley and Associates. Is it architecture firm?
that's right. Whitley and Whitley Architects. You got it, Sybil Wilkes.
Yeah. Well, thanks, Kim, for taking some time
My
away from your
red.
film. Wear your red proudly. You know the importance of maintaining good health, and so that's why we wanted you to have a spot on the show today. Now, you did not give birth to Joshua, but you did bring him home from the hospital, and so you know what it means, especially when it comes to our children and being there for our children.
Mhm.
What we are talking about is Black maternal health. And this week is Black Maternal Health Week, a time to raise awareness and to inspire activism around the issues related to maternal health and reproductive justice for Black women as we talk about the disparities, especially Kim. And I think we'll both learn some things today as we endeavor to learn more about Black maternal health and what can be done to improve the disparities. Kim, as I mentioned, you nor I have had children, but I do want to just talk about the fact that we've had experiences with our friends who have gone through the joy of childbirth and may have faced some challenges.
Oh, absolutely. I have a lot of friends also that have had some challenges, and family members. I mean, my mother even had a challenge with me.
Well,
Uh, yeah, really civil. During childbirth.
I got you. I got you. My mom too. Do you
Yeah.
remember what it was?
Well, absolutely. My mother, she told the story. Well, my dad would tell the story all the time that either I had turned funny, the placenta shifted, something, but the biggest part of the story was the doctor came in and my father was in there and my mother, and he told my father, well, you're gonna have to make a choice. Um,
Wow.
yeah, either the baby or your wife. So right there, my father's like, first of all, can we step out of the room? My my mother's like, wow, upset her so much,
Yeah.
just
Yeah.
dumb. And my father, you know, of course, said to save me. No, he didn't. He said, to save both of them. But they're like, if it really comes down to it, that we're going to have to make a choice. And having a praying grandmother,
Mm.
um, just luckily nothing happened to my mother and I survived. So we both survived. But
Wow.
that is the story they tell me. Especially my father's like, you almost run here. So I don't know what you're talking about. You almost didn't make it.
Well, Kym, I will tell you, my mom had a challenge too in giving birth to me, and I was her only, first and only,
Mm.
as it turned out. It was such a great experience. Um, her gynecologist, her obstetrician gynecologist, was her uncle. And so he took very good care of her, as you might imagine, but they had
Mhm.
difficulty in getting me out through the vaginal canal. And so they did have to go in and do a C-section. It turns out that it was a cyst that was right there at the canal that prevented me from coming out. And so they did what they had to do,
Wow.
but it was the good care that she got from my
Mhm.
uncle, that assisted them in a successful entry for me. But we were, whether we grew up hearing those stories or we have our friends that have had their challenges too. Black maternal health is
Oh,
very important.
no, we can even, I can get deeper on you. I have a brother. My oldest brother's name is Kyle. Well, there was a Kyle before him. He's Kyle the second.
Oh,
My
okay.
parents are in the Air Force, and my mother gave birth full term. And you know, this is gonna sound bad, but she looks white. They thought she was a white woman, but on the birth certificate, you know, it wrote black, Negro, the
Hmm.
baby. And just to say, my mother says they didn't clean out his canal, like go in and suck out his throat.
Hmm.
All I know is my father said they got on a military helicopter with the baby. He did with the baby, and
Mm.
took him to probably Dallas with a bigger airport, because I think he was in Waco or something. But um, Kyle number one did not make it.
Oh,
So yeah,
Kim.
so when we talk about uh, them, I'm not saying that the military, I think but there was definitely racism, of course, then. And
Yeah.
we don't know if my mother really got the best, health, or, I mean, best help, or the baby, got the
Yeah.
best medical care. So,
Absolutely. Wow, I'm so sorry. And I do remember you talking about Kyle 1 and Kyle 2, but I didn't understand, all that went into that. So I'm very sorry. But Kyle 2 turned out to be just the right thing, right? He's a
yes,
handful.
he's a handful. He's both of them.
Well, Kim, I thank you for sharing that. And for those who also want to share with us, we welcome your stories as well. And so let's just take a second as we introduce our next guest and remind people this is check in and check up for your health. Comedian Kym Whitley has shared with her experiences with us, and now we are joined by Dr. Rachel Bond to discuss women and maternal health. Dr. Bond, how are you? Welcome.
Thank you. I'm ready. Let's get started.
Okay. Let, let me just tell people you are a women's heart health and prevention specialist devoted to expert diagnosis and treatment for improved patient outcomes. Your expertise is in cardiovascular disease with special interest in women's heart health, prevention, pregnancy related heart disease, and cardio oncology and autoimmune related heart disease. That's a lot to put on a business card, Doc. Wow.
It is. It works though.
Okay, well, very good.
I'm
And
trying to get
you
my pencil and pen to write all this down about her.
well, keep scribbling because I got more. Dr. Bond is also a well known spokesperson for the American Heart Association Go Red for Women campaign. Now, Doctor, let me just start here. And Kim, I don't know if you know a lot of these figures and statistics. They were new to me as well. According to a new federal report, the state of and rate of pregnancy related mortality in the U.S. has been rising steadily over the past 3 decades. And the maternal death rate among Black women is still 3 times the rate for white women. Doctor, it seems like, just as things, you don't even consider that. You don't even think about the mortality rate when people are going in to have children. But now this rate, 3 times that of white women. Why is that?
Yeah, and it's actually important to put it into even further perspective. The number of deaths in the year 2022 are actually higher than what they were 20, 30 years ago. So we're
Wow.
not going in the right direction in the United States. And we as an industrialized country are really the only industrialized country that are having rising rates of maternal mortality. Now, you asked a really important question. Why is this impacting specifically Black women who are dying the highest when you think about maternal death in particular, 3 times the rate of white women? And we know that many of those risk factors that definitely increase one's risk during pregnancy are disproportionately affecting women of color, specifically Black women, such as diabetes, high blood pressure, being overweight or obese. But at the central core of why we're seeing these highest rates, it really has to do with those psychosocial stressors, particularly the misogyny and the systemic racism that we're seeing in our society. Kym, you mentioned even thinking about your mother and Kyle number 1, was there racism that led into that? And unfortunately, racism still exists in the healthcare field as it stands right now. Maybe it's not as explicit, meaning right there in your face, but there's definitely implicit biases or unconscious biases that we think about that we as healthcare clinicians have to do a better job, particularly in listening to these women. So the core of why we're seeing these disparities at the end of the day, unfortunately, is the systemic racism that still exists.
Kym, does that surprise you?
Yeah.
In today, as opposed to years ago when your brother.
It's, I'm thinking like, oh my gosh, of course it's gotten better. How can it, that's just like flooring me. Like, how can that, as we become more aware, and especially I look at this as we get, more female doctors, but is it society? Is it that we're not taking care of ourselves like we used to back then? We're not eating the proper foods. We're going more in the fast foods. Our health, we're not taking care of our health as women, and then we get pregnant and we're fast foods. I'm just wondering, how is all this connected?
It is connected, and I emphasize the fact that there are the ability to ultimately have the access, right? Access to those healthy foods, as you mentioned. And unfortunately, many of communities of color may not necessarily have that access.
We are in food deserts, as they call
it.
Yes.
Exactly, in food deserts. They also may not have access to even adequate health care. A lot of the healthcare as it stands right now is what we call fragmented. And we really want to make sure that starting in childhood, even, we're instilling a lot of these heart healthy measures, making sure you're exercising, eating healthy, reducing your risk of all those risk factors I mentioned, the diabetes, the high blood pressure, the high cholesterol, and the obesity, which will impact them once they do, and if they do decide to have a pregnancy. So a lot of it is centralized to the structural components, because if they don't have access to healthy living, healthy eating, the ability to safely exercise, it's going to be challenging.
Dr. Bond, you say that there are healthcare practitioners like yourself and advocacy groups that are raising the alarm as we are doing today, that the pandemic, which is, we know, disproportionately affected communities of color and strained the resources, especially in terms of healthcare and what have you, increased barriers to care for pregnant people. What can we do? What in terms of lowering those barriers, or is it incumbent upon us to encourage more Black folks to go into the medical field so that we can stop some of these health disparities and get more OBGYNs that can help us reduce the Black maternal mortality rate?
Yeah, so that's a very loaded question because there's so many things we can do. You brought up such good points. So number one, we have to diversify the workforce, particularly the healthcare workforce, not even just with the obstetricians, but starting with our primary care clinicians as well as cardiology. Other things that we have to do in the healthcare is no longer work in silos. When the obstetrician only thinks about the baby, thinks about the pregnancy, and doesn't think about the female as a whole, that's when the problems lie, because a lot of the issues that occur during pregnancy will impact your future life. It will impact you in the next 5, 10, 20, even up to 20 years when it comes to cardiovascular health. Beyond that, we know that we definitely need to retrain our medical students, our nursing students to really be aware and be more culturally competent and really be more empathetic towards these vulnerable patient populations. And I think that by doing those measures, we probably will see some sound change. But It's also important that we ensure that these women are advocating for themselves. So educating
Yes.
yourself on what are your risks, making sure that before you're even thinking about planning a pregnancy, you're speaking to your primary care doctor to ensure that your blood pressure, your cholesterol, your blood sugar, all of those are ideal and optimal, especially if you have a family history, not just of heart disease, but even if your mother had complications during her pregnancy, there is a risk for you to have those complications as well. So it's so important to know your family history, not just from a heart health perspective, but also a pregnancy and maternal health perspective as well.
I just thought about this because if I were to ever have children, which that horse has now left the barn, but if we talk about the family history, not only my mother, but my mother's mother died giving birth to my mother. And so,
Oh,
yeah. So
oh,
I
wow.
wasn't even thinking about that. I was just thinking about, thank God for my Uncle Dave, Dr. Rogers, who
Uh-huh.
saved my mother's life. But, you don't think about these. And the
Mhm.
other part, doctor, we got to talk to each other about these things, right?
Yes, yes, we have to talk to each other when we're having family reunions, sitting at the kitchen table. We need to make sure that we're having these discussions about what medical conditions we have, what experiences we encountered maybe during our pregnancy, but more importantly, if they are related to heart disease. And one thing that I think we need to emphasize, why even I as a heart specialist am talking about Black maternal health, is because heart disease is the leading cause of death in the United States when it comes to maternal mortality. And it's something we could prevent 60% of the time. And a lot of that has to do with knowing what your risks are and making sure you're seeing your clinician, but a
Yeah.
clinician you can trust, right? One who's willing to listen to you as well.
Right. So there's two things. I'm sorry, Sybil, I have to
Go ahead. No,
understand.
please.
Okay, I have to understand this. When you say it's a high rate of mortality because of heart health, is it something that you would know before you're pregnant, or does it happen while you're pregnant? When does this risk happen? Is it a pre-existing or is it during? Yeah.
So, heart disease can actually develop as early as childhood. When we think about it,
Mm.
our arteries in our heart have this substance, which is called cholesterol, which is like a fatty buildup. And what we expose to those arteries make that fatty buildup increase more and more. So, the higher our blood pressure, the more cholesterol we have in our system, the more blood sugar we have in our system, that impacts our overall heart health. And as a result, this is why we're encouraging to ensure that even starting in childhood, you look for those risk factors, especially if they run in your family, but not just look for them, make sure that they're ideal and they're being managed accordingly. Now, what happens during pregnancy that places these mothers at a much higher risk? Because we know those risk factors lead to high blood pressure with pregnancy, diabetes with pregnancy, a condition called preeclampsia, which is extremely dangerous, where your blood pressure becomes extremely high and it could affect your organs. All of those in that immediate period can definitely impact your overall heart risk. But what we're noticing now is that even 10, 15, 20 years later, many of these women are coming in with heart attacks because they were not making sure that those more controllable risk factors like blood pressure, cholesterol, blood sugar, and weight are
Mm.
ideal and under control. And a lot of this has to do with the fact that their clinicians were not having these conversations with them. And that's why I bring back into the mix the importance of women advocating for themselves. Knowing if you've had any of these issues, that you need to see your primary care doctor within 3 to 6 months after your delivery to ensure we can check all of your numbers, your blood pressure, your cholesterol, your blood sugar, make sure your weight is ideal, and depending on what those risks look like, possibly even see a
Mm.
cardiologist.
And
Uh,
doctor, does it help? Are you seeing improvements in the fact that, as we mentioned before, having doctors that look like us, that could perhaps that we feel more comfortable in having these conversations with, and they may be looking out more for us? Is that fair to say?
That is very fair to say. We know that there is a high amount of mistrust in our community, and that's extremely understandable. What we also know is that data has shown that when you have patients that identify with their provider, they're more likely to follow up, they're more likely to have better outcomes. But more importantly, when our workforce is more diverse, those that come from less diverse populations actually are more empathetic to the patients coming from diverse populations. So just even me, I'm in theory a unicorn in the cardiovascular world. There's only 2% of Black women in cardiology. And as a
Wow.
result, that's why I want to get my voice out there to really motivate the younger population of medical students and residents to go into this field, because we need to get into this field to ensure that we are improving the outcomes that we're seeing that are disproportionately affecting our people.
And when you think about heart disease being the number one killer, in terms of Black folks, of women, it really is necessary, isn't it?
It
Yeah.
is.
Kym, before we move on, you wanna say
um,
something?
I just want to have a really quick conversation with Dr. Bond. Is that I did a show, of course, with the OWN network called Owning the Conversation, and we talked about the health. And a lot of Black women and women of color have a problem in the healthcare industry of not feeling seen. They're not seen, and how can, if you're uncomfortable with your doctor, uh, I think some women and people feel like they can't move on or get another doctor. What do you say to them?
Doctor, before you answer that, we do have to take a second, and we're going to
Okay.
move on to our next segment. But that is going to be a question that we're going to return to. I promise you,
Okay.
Kym. Okay.
Okay.
I'm getting a little anxious right now in having this conversation, but I think
Yeah.
the conversation is good, as well as the information that Dr. Bond is giving out to us. Okay, so just want to remind people that are watching, thank you for joining us today for another episode of Check In and Check Up for Our Health. Our guests today are Dr. Rachel Bond, and one of very few Black female cardiologists in the country, and we are so glad to have her today. And my co-host, my friend, comedian Kym Whitley, is here, and we're discussing Black maternal health and the health disparities for Black women. We are also going to bring in a guest, and I think you'll find this, and I'd like for her to be a part of this conversation too, Kym, as we talk about having the conversations and feeling comfortable with your physicians as well as each other. So let us now go and welcome in Kisha Stewart. She has a compelling story to share. Wakisha is her full name, but Kisha, thank you so much for joining us.
Thank you for having me today, Sybil.
It is great to have you, and I want you to before we get to your story, I want Dr. Bond to return to that, because I think you probably have some things that you want to share as a healthcare worker, as well as a young woman. So let's talk about these conversations. As Kym was saying, Dr. Bond, let's talk about that conversations and having them.
Yeah, so I would probably say that the most important thing that I encourage all of my patients to do is, if you're not comfortable with your clinician, or even the conversations you're having with your clinician, because you feel that they're not listening to you, they're not answering those pressing questions in the back of your mind, it is okay to request a second opinion. It's actually encouraged. And I know there's fear that comes with that, but that's where having a trusting support system, either it be from family, another healthcare clinician, I'm a specialist, so making sure that you have that bond with your primary care clinician is key, because a lot of times they can help navigate for you who else may be somebody to seek a second opinion from. When we think about maternal health as well, one thing I do want to emphasize is the importance of having a non-professional support person in the room. And that would be somebody like a doula, as an example, because a lot of times they help to advocate for you during that pregnancy. They're your eyes and your ears, and they're really being your voice when sometimes you may not be listened to. And we know that studies show that doulas have really improved the outcomes when it comes to Black maternal health in particular.
Kisha, from the information that we have, apparently you never thought having a baby could affect your heart until you had a heart attack. Is that true?
That's correct. That's correct.
Kisha, you got to tell us your story.
So I don't have a family history of heart disease at all. In October 2011, 2 weeks after I delivered my second child, I had a spontaneous coronary artery dissection. So basically, what that means is,
Yeah, I was gonna say English, please.
Right. A what?
So a major artery in my heart tore, and that created a 100% blockage. And subsequently, that caused me to have the widowmaker heart attack.
Oh wow.
The only way that I could be saved was through intervention. They had to place a stent basically to save my life. I was 31. I was an athlete my whole life. I danced for 17 years. I was not your typical, heart attack candidate. When it did occur, when I went to the hospital and I was telling them all of my symptoms, because women have very different symptoms than men.
Mhm.
So we were at a dinner party. Friends of ours decided to invite us over to give me a little break because I hadn't been out in such a long time. And during the dinner party, I started to feel like I had brain fog. I felt a little disoriented and extremely fatigued, which, 2 weeks after having a baby, you would consider to be normal.
Mm-hmm.
Suddenly, I had this sharp pain in my chest that took my breath away. I went to the bathroom, splashed some water on my face. I figured I had a little bit of wine. Maybe it's hitting me, a little bit harder than it should. I went back out. I continued to have conversation. And then suddenly it felt like my chest was in a vice, like it was just being crushed. And I had pain from the front of my chest straight to my back. It radiated up into my jaw, as well as into the back of my neck. And then I had the tingling and numbing of my left arm, and I was feeling nauseous. At the time, I didn't believe that I was having a heart attack.
Of course.
Although I did know all the signs and symptoms, but why would I have one at 31? My husband said, "Are you sure you didn't have, too much wine?" And I said, "No, I didn't. We need to go to the hospital." So he drove me to the hospital. And while driving me, I was vomiting outside of his car. We get to the hospital and I have shortness of breath. I'm still in pain. And I am explaining all of this to the receptionist at check-in. And she looked at me and she asked me, what was I doing prior? And I said, I just had a baby. We were out at a dinner party. And she said, honey, it's anxiety. You're having a panic attack because you're out for the first time. And
the receptionist.
This is where
I slapped it.
And this is where, as a nurse, one of the biggest things for me is I tell patients, know yourself, listen to your body so that you can advocate for yourself. So I insisted, I told her, no, something is wrong. And she said, okay, well, you can wait in the waiting room.
No.
So I sat in the waiting room with my husband, still in pain. I got called, not to triage yet, insurance information. I got called to provide my insurance information. And then eventually I get brought back into triage. When I was in triage, they did an EKG. And they said it was inconclusive, the tech and the nurse that initially saw me. I started to vomit again, still shortness of breath, still pain, everywhere, still numbing. And then suddenly a more senior nurse walked by the bay that I was in, and she said, she's having a heart attack. She needs to get to the back now, call the doctor. And then all of a sudden, everything just kind of clicked, but it
Did she call them any kind of names? I mean, when the senior nurse, was there any kind of foul language thrown in? You dumb,
no, she kept
none
it
of that
professional,
stupid,
but
nothing.
She had that look. She had that look like, what is wrong with you? This woman is obviously experiencing something. So
beyond a panic attack.
Right, exactly. And I know myself, right?
Sure.
At the time, I was a nursing assistant, but I knew myself. My mom is a nurse practitioner. I have doctors, nurses. I have a lot of healthcare workers in my family. So I was very confident in the fact that I was not having a panic attack. So when they brought me back, they did all the things that they usually do. They give you, oxygen, morphine, nitro, nothing was working. And at the time, I thought I was going to die. I turned to my husband and I said to him, let Diego, that was my son that I just had, I said, make sure you tell him how much I loved him and how much I wanted him, because I'm not going to make it. Oh. Because at the time, we're talking about me going, it's almost an hour since I felt, those first symptoms. Mm-hmm. I was just so sure that it was going to be over. And the hospital, of course, that I went to didn't have a cardiac intervention unit. Yeah. So I had to be rushed to a separate hospital. And on the way, the ambulance driver got lost.
Oh, I can't take this story. I'm signing off. Yeah. I can't take
There were so many times.
This is a horror story.
Really?
Oh my God, Kisha.
I say that I shouldn't be here.
Yeah.
There were so many instances during that night where things could have gone terribly wrong. Finally, I get to the hospital, and thankfully enough, the cardiologist that was on call had seen a case like mine the year prior. And he had been a cardiologist for 30 plus years. SCADs are, well, at the time, 10 years ago, they were thought to be rare, although now they're saying that it's not as rare as we think, but it's rare to meet a survivor. Because
you called it the Widowmaker.
Yes, it was the Widowmaker. It was the one where, that's what widows,
and
that's
this
what happens.
Cardiologist had been a cardiologist for 30 years?
For 30 years, and he had never seen a spontaneous tear except for the year prior to mine happening.
Okay.
Wow.
Did he take you immediately back, or was there something else that happened in this horrible?
They were ready for you.
Back. Yeah, they were ready for me. Like I said, we got lost, so they were ready and waiting. So they took me in. He performed the stent, and as soon as it was placed, it was this relief. It was just this instant relief. And Widowmaker heart attacks, 1 in 4 survive. So 25% make it. I had a 75% chance of not making it. And I implore everyone to know yourself, because if you don't know yourself, if I wasn't confident in what was happening and knowing that it was wrong, I could have left. How many women who might have been timid, could have dealt with that receptionist and said, you know what, maybe it is a panic attack. Let me go home. And then unfortunately go to sleep and not wake up.
And since then, have you gone back to slap everybody? I just need, please, to make this story feel good. I need to know.
I did finish my nursing degree. I graduated valedictorian of my class so that I could make changes. Because being an African-American woman, a lot of people say we're dramatic. They don't want to believe us when we're telling that we're having
we have
pain.
A high tolerance for pain.
We have a high tolerance for pain. Right. So
my
whole thing.
She did not, Kym. I think we can.
You didn't slap. You didn't go back to one. You didn't go back to the driver and say you almost killed. You didn't go back to that receptionist and say, "Don't you give another piece of medical advice."
Let me tell you, Kym, when I was laying there, all I could think of was, I'm going to die. These people don't care. I'm just going to die. I'm laying in this ambulance and I can hear the conversation going. The paramedic who is actually right next to me, she kept me calm. She kept telling me, you're going to make it. And I kept saying, no, I'm going to die. We're lost. I'm going to die.
By the grace of God, not by those crazy human beings. I'm sorry. I know Sybil, you got to ask.
I
asked Dr. Bond something about this. Okay, go ahead. I can't take it.
No, hold your questions and hold yourself. Okay, so everybody, let's take a breath. Kym, I really need you to take a breath.
Okay.
Okay. And we're going to come back and we're going to continue our conversation. Okay. So take a breath. Kym, I'm not seeing you breathe. Okay. Okay. Dr. Bond, I know that you have some things you want to say. Kisha, I know you want to reassure Kym, and Kym's got some things that you need to do retroactively to these people who misdiagnosed you. All right. So in this segment, I want people to remember you are watching Check In and Check Up for Your Health. A great conversation. We're talking about Black maternal health, but we're also talking about the general health care, especially for Black women, as Kym and I did not give birth, but we know the situation and the treatment. So Dr. Bond, can you talk to this? Obviously, we know Kisha's story is not uncommon. We know, and so can you just kind of give us some, because Kisha has talked about knowing your body and the way it responds. Can you give us some tips and some things that we can use, all of us, mothers and not mothers, in terms of responding when we feel that we aren't being listened to and being misdiagnosed?
Yeah, I think it's actually important to highlight, first of all, as Kisha very nicely said, that women normally do present with more accompanying symptoms, right? So when we think about the classic signs of a heart attack, it's more of that elephant sitting on the center of your chest that may radiate up your neck or down your arm. But a lot of times women may not feel those symptoms. They may feel winded or short of breath or tired. As you mentioned, you were so tired, you were fatigued, you thought it was due to pregnancy. It's also important to acknowledge that the very common cause of a heart attack is that a plaque that I was referencing becomes unstable and then it ruptures. But what Kisha had, as she very nicely mentioned, was a tear. And that type of heart attack, which is called a spontaneous coronary artery dissection, or SCAD, does disproportionately affect women. And a lot of times it's due to hormonal changes. So it makes sense that it was during her current pregnancy, or more importantly, that 2-week postpartum period, because we're still going through those hormone changes in that postpartum period. What I would say for women in general is that, as Kisha mentioned, you know your body better than anyone else. And if you're having the slightest inkling that you're having something going on with your heart, you need to use those words, "I'm having a heart attack." They can't ignore you when you go to the emergency room. And if they do, you need to say, "I want to speak to the doctor because I feel like I'm having a heart attack," because what they did to her is inexcusable. Someone coming into the emergency room with active chest pain needs to immediately go to the hospital, get an electrocardiogram, which looks at the basically electricity through your heart, so we can figure out what's going on. Not wait in the waiting room for the physician to eventually see you an hour, 2 hours, 3 hours later. Because when it comes to the heart, time, as we like to say, is muscle. And that's the most important thing. So be your biggest advocate. You know your body the best. Make sure you're advocating for yourself.
And it wouldn't hurt to have, as you mentioned, to have a non-medical advocate by your side as well. Is that?
Yes.
Yeah.
100%.
Yeah. And
Kym?
it wouldn't hurt to, when you go up to the receptionist desk and they say that, if you just throw everything off the desk, just sling it all off the desk, they are going to see you. You say, "My arm," just sling it off. If you don't take me to the back. Now that maybe that story. When I tell you, my heart is racing. I don't know if this is good for my heart. Now I got a question. Now, when you get a stent, and that's why, I was ambassador for a minute for American Heart Association. I definitely tried to speak about it because of heart health in my family. And I got a stent in 2016, 17, I don't know. But the same situation, mine was not, but I'm going to tell people because of Joshua, that's why I got a stent. If that's instead of chicken, I think that might be better for me to say, because maybe I should do that. But how long do stents last? I just wanted to ask that. How do I know when it's time to get a new stent?
Yeah, so we've come a long way in the medicine field, where we've been able to have such phenomenal advances where stents can last decades upon decades. It really depends, though, on what you're doing to your body, because a stent is just a temporizing measure. We want to make sure that whatever disease developed doesn't come back. And again, thinking about the classic type of heart attack, a lot of times that disease is due to risk factors, cholesterol, diabetes, being overweight, not exercising, and having high blood pressure. So to make sure that that stent remains open, you want to make sure that all those risk factors are ideal and under really good control. So how long a stent will last for really depends on you as the individual.
And Kym, you're doing things to take care of your health now too. Let's be honest.
I've lost the weight. Yes, I've lost the 30 pounds. I'm a WW ambassador. I forget because I think I'm exercising for vanity. I keep forgetting, no, you're exercising to live, but I forget that. And I'm like, oh, but I should every day do something, but I don't think about it. Sometimes I'll miss my high blood pressure medicine. And I'm like, I'll get it tomorrow. Yeah, I got to get better. You're absolutely right. I think even if I work out 10 minutes a day, every day, do something for my health. You're absolutely. I have been, but I need to do something.
So Kisha, let's talk about the advice that you give to women like you, and having gone through this, and you are an ambassador for the American Heart Association. You're a Go Red woman, and all of those things. That at the heart is you're talking to your girlfriends like us. What are you telling them? What's the advice that you're giving them?
Well, first and foremost, listen to your body, because your body is an amazing machine and it will give you signs that something is wrong, but you have to pay attention. You have to pick up on that. Go to the doctor, know your baseline. If you know your baseline or what's normal for you, if you end up at the hospital, you can slap someone and say, no, Kym told me to slap you because I know my baseline. And this is not my baseline. But in all seriousness, if you know yourself, you can be more confident in fighting for yourself, because the only person who's going to fight for your life is you. No one else knows what is going on with your body. So first and foremost, listen to your body, know your body. Second, make sure you're going to the doctor and make sure you're doing all the things that you're supposed to do. I'm not saying that you have to eat salads all day long, every single day, but there are certain things that you can do as far as your diet is concerned. And I don't even like to say diet. I like to say a lifestyle change, because that's essentially what it is, because you want to continue it for the rest of your life, because you want to live. So for me and my family, we encourage fruits and vegetables at every meal. 2 out of the 3 of my children have no problem. There's one that I have to make sure he eats his vegetables before he touches anything else. But, things like that. For Black families, especially, we have to start, in the beginning when we're young. We have to start teaching our children how to eat well, how to get up and be active on a daily basis, because then we can stop the cycle. Diabetes runs on both sides of my family. But my parents, when I was younger, they always emphasized proper diet and activity. I mean, we were always all over the place. And my mother we never had junk food in the house. We never had soda, chips, candy, nothing. We loved going to other people's birthday parties because that was the only time we could have cake. But I really do think one of the reasons why I survived and I had a better outcome is because I already had all of that under my belt. I already had that foundation. So when I had to alter everything after my heart attack, it wasn't so hard for me to do that, because I was already living a healthy lifestyle.
Yeah. Wow. This is powerful.
Absolutely.
This really, and I thank you for sharing your story, and I'm sorry for raising your blood pressure, Kym. I'm right there with you. I mean, it's a thriller, and knowing that you're here to tell the story reassures us of the outcome. But just my God, what an incredible story, Dr. Bond. I want to, if you want to add anything to that as we wrap up this particular segment.
Yeah, no, I think that the American Heart Association says it best, right? They have 7 simple tools called Life Simple 7 that we really should live by. So as Kisha and everyone on the panel today said, making sure first you go to your doctor and you know your numbers, your blood pressure, your blood sugar, your weight, your cholesterol, making sure you're not smoking and drinking alcohol in excess, and making sure that you are exercising, and more importantly, eating healthy. But as Kisha very nicely said, don't think of it as a diet, but it really should be more lifestyle. I love the fact that we're talking about the family approach, because as one of my amazing colleagues loves to say, instead of focusing on generational wealth, we should be thinking about generational health.
I love
right?
that.
I love that too. I've stolen it from her a multitude of times, so I'm going to do it again.
I'm taking it too now.
Yes.
Exactly. All right. So let us take a break, ladies, and just because Kym needs to breathe.
Yes.
So let's breathe. And we'll bring it back and remind people we are checking in and checking up for our health. Our guest today, Dr. Rachel Bond, Kisha Stewart, Nurse Kisha Stewart, and my friend who encourages violence but doesn't really mean it because she has such a good heart, is Kym Whitley, comedian Kym Whitley. And we're discussing the disparities that exist, especially as it relates to Black maternal health and Black women's health in general. And we've been discussing this, and as we close out, I just want to give us an opportunity to talk, because we have been talking about maternal and maternity and things like that. And Kym, we have both mentioned our mothers, but I want us, and especially as we're getting close to Mother's Day, give everybody an opportunity to share your favorite memories with your mother, of your mother, or as a mother. And so, Kisha, I mean, you can tell your son every day on his birthday, look, do you know what I went through for you? I know the message I told you, Daddy, but come on now. Would you like to share a memory of your mom or of being a mother?
Well, I'll share something about being a mother, because obviously there was a point where I thought that I wasn't going to be anymore. And I actually had a third child. I had another child after I had, my second. So I really do appreciate being able to see the world through their eyes and just their innocence. Sometimes we tend to forget what life is really about. But when you're looking through the eyes of a child, everything is just so precious. Everything just seems so much more simple. And I love that. And I love being able to have those conversations with them, because I truly enjoy it. And I know that, life is short, life is fleeting. And there's a chance that, my SCAD could happen again. So those are the moments that I enjoy, just being with them and seeing things through their eyes.
And being present. That's something that I'm
Yes.
still working through, but definitely being present and in the moment. Yeah, that's very special. You want to give a shout out to your kids and your husband?
Yes, my husband Mike, my older son Donovan, who's going to be 16 next week.
Wow.
My son Diego, who is 10 and a half, and my daughter Athena, she's 6. She's going to be 7 next month. What I like to say is 6 going on 17, because she has that strong woman. She's very opinionated and certain of herself already.
I wonder where she got that from.
I have no idea. So, well, I don't know. Got it from my mother.
Okay.
Right.
Dr. Rachel Bond, what about you? Do you have any memories you'd like to share?
Yeah, so I will just disclaim that I'm currently just a mother to a fur baby. However,
I'm a fur godmother, so yeah.
But I do want to probably share a memory of my mother, because I wouldn't be where I am today without her. Even talking to her, actually before coming on this particular panel, I will say that she's instilled in me really the importance of maintaining not just sort of that direct mindset when it comes to my professional career, but more importantly, the meaning behind physical health and mental health, making sure that we do take a moment to understand that our physical health will never be well without our mental health being well as well. So I do want to give a shout out to my mother, and as well as my father, who both.
So what are your parents' names?
My mother's name is Anne, and my father's name is Richard Bond. Anne and Richard Bond.
Richard Bond. I love that. That's really sweet. That's great. And Kym Whitley, what about you?
Well, I'm a mother, and I had a mother. She passed about 6 months after Joshua was born and brought into this world. But I have so many good memories of my mom. But I will say this around what we're talking about. I was going to say another memory, but I remember my mother telling me years ago, because I've always struggled with my weight. And she said to me, she said, I wish I would have fed you fruit and vegetables when you were growing up instead of candy and soda. And she said, but I did what I knew. She said I did the best I could at the time. I didn't know any better, but it stuck with me. And I said, Mommy, it's okay. I'll learn how to eat right. But she said, I just really wish I would have started you off with fruits and vegetables. But she doesn't even realize from her telling me that when I became a mother, that stuck in my head. My child, Joshua, who's 11, loves fruit more than vegetables, but he'll eat vegetables. But he really is not a meat eater. He is a fruit and vegetable eater and some candy. But that was just, I said, I thank my mother, Kym Whitley, for giving me that nugget because I look at my child just like this conversation, the nuggets that you've given me, that I will, go back to working out, taking care of my heart health, looking at my numbers. But that's the same thing, and making sure now with Joshua that I forgot that we're teaching, that he has to exercise every day, do some kind of activity. I'm going to make sure he drinks more water. But he does do that. I don't let him drink soda. But just those things. So I want to thank you for that. But my mother gave me that nugget. So, and
That's really
since I
nice.
am on Two Funny Mamas, I want to make sure everybody knows we're going to be
Yes.
live. I got to make sure I give a shout out. Me and Sherry Shepherd, we are going live for our 100th episode,
Oh,
everyone.
awesome.
That's right, 420 next Wednesday at 7
Congratulations.
p.m. on YouTube/Two Funny Mamas. And
How
we will
appropriate
talk
it's on
about this.
420.
The 420. 420 live, 7 p.m. Two Funny Mamas. That's funny.
7 p.m. Eastern.
7 p.m. Eastern time. That's right.
Okay.
YouTube.com/Two Funny Mamas. Uh,
And
so
they are
I'm
two
very excited
wonderful
about that.
mamas
A
too.
100th
Congratulations.
episode. Can you believe
Congratulations.
it?
That is awesome. And I have
Yeah.
been a guest on that, and it's a great show. And I highly recommend that everybody subscribe to their channel as well as tune in next week. I want to send a shout out to my mom in heaven, but she was one of those people who always believed that you make a mistake and you erase it and go on. And she said that's why God made erasers. And she always told me that. So if you fall down on your diet, let's pick it up. Let's get
Yeah.
moving. Exercise, whatever it is, your doctor's appointments, and coming through this pandemic and what have you. This is the opportunity to pick it up and like she said, God made erasers for a reason. Let's use that. Let's move on and to take it up the next day, and let's do it as quickly to the next as quickly as you possibly can. She also used that in regards, I believe, to her marriages. She was married 4 times, so that
What?
is
What?
yeah. My mom's married 4 times.
Simple.
Yeah, absolutely. My
Oh,
dad
and
was the
I got to give
last.
a shout out to my daddy, William Whitley.
Please.
He's watching. Hey, Dad. I just want to make sure I said, hey,
Architect
Dad.
extraordinaire in Cleveland, Ohio.
That's
All
right.
right. So as we close this out, ladies, I would like to share. We have Yogi's Jewels every day at the end of our programs, our daily inspiration. And this is what lies behind us and what lies before us are tiny matters compared to what lies within us. And all of you have demonstrated what great hearts you have and what great minds you have. And we thank you so much, ladies, for sharing and joining us today, and for being a part of this. And bless your hearts. Absolutely.
Oh,
I
that's cute.
thank you so much to Kisha Stewart. You are an amazing woman. You really are.
Thank
Truly,
you.
thank you for all of your strength and coming on and being such an inspiration to so many people. Having heard your
Thank you
story,
so
just
much. That means a lot.
we really appreciate you. Dr. Rachel Bond, thank you for your heart and your mind. Absolutely. Thank you for all of your words of wisdom today. And how can people keep up with you, Dr. Rachel Bond?
Oh, yeah. So I am on all the social media platforms. So if you would like to follow me at Dr. Rachel M, as in Marie Bond, you can find me on Twitter, Instagram, Facebook, etc.
And Kym Whitley, we know Two Funny Mamas. How else can people find you?
You can find me across the board at Kym, Kym Whitley, Whitley, of course, on Twitter, Facebook, Instagram, all of that. So yeah, please, yes, please follow me. I need it. I need watching. And I got to thank my brother Scott Whitley. You know, he's the tech man over here.
And he did very well by you today. So thank you very much, Scott. And to all the Whitley men, including Joshua. I also want to thank our crew here as well. The ladies here have met our technical director, Chica, as well as our executive producer, and especially that's Yolanda Starks White and Cherie White. And we want to thank our partners at the American Heart Association and forever, ever, ever, the best there ever is, Arika Kason. So thank you all very much for joining us, and I wish you good health. Thanks so much, ladies.